how does a prepartum diet with an antibiotic supplement affect health, production, and reproduction in dairy cows? Have you ever wondered about the consequences of hypocalcemia in your herd? Milk fever, also known as clinical hypocalcemia, is the tip of the iceberg of problems with low blood calcium. Ideally, it should affect less than 2% of your fresh cows. Subclinical hypocalcemia requires blood tests to measure, but it affects many more cows. In many herds, subclinical disease might affect more than 50% of fresh cows. And while we can't see signs, it's been shown to negatively impact health, production, and reproductive performance. But what can we do about it? Have you thought about implementing a negative DCAD diet for your dry cows to prevent hypocalcemia? You've probably asked yourself, will it improve health, milk production, and reproductive performance? Researchers at the Ontario Veterinary College, led by doctoral student Rita Coto-Serrano, recently set out to answer these questions by conducting a research trial on prepartum DCAD diets. DCAD stands for dietary cation-anion difference. Feeding a negative DCAD diet means we feed cows more anions than cations. This leads to a mild metabolic acidosis, which results in a slight drop in the body's pH. The effect? The cow responds more quickly to the drop in blood calcium that they experience around calving when they put out a lot of calcium and colostrum. This means that negative DCAD diets reduce the chances of both clinical and subclinical hypocalcemia. But does that mean that cows fed negative DCAD have fewer diseases, produce more milk, or get pregnant sooner? Their trial set out to answer these questions. They looked at more than 1,000 dairy cows from 4 herds to assess the effect of a negative DCAD diet prepartum on their health and performance. They included 360 first lactation animals and 726 second lactation or higher cows. Half of these animals received the negative DCAD diet, and the other half received a positive DCAD ration, with the placebo supplement mixed in the TMR. Every 3 months, they switched the treatment diet in each farm for a total of 1 year. Urine pH in close-up dry cows was assessed weekly. They achieved their target of a urine pH between 6 and 6.5 in cows fed the negative DCAD. They monitored cows throughout the postpartum period and recorded data related to health, milk production, reproduction, and culling. They measured the occurrence of retained placenta, metritis, displaced abomasum, and mastitis. They took blood samples from each cow twice in the first 2 weeks after calving to measure ketosis. They examined every cow at 5 weeks after calving to detect reproductive tract infections. So what did they find? As expected, mature cows fed the negative DCAD diet during the dry period had increased blood calcium concentration in the first 4 days in milk, meaning that fewer cows were affected by subclinical hypocalcemia. Blood calcium concentrations were not different between treatments in the first calvers. But did it change health? Mature cows had fewer cases of milk fever, especially among overconditioned cows, and were also less likely to have multiple diseases postpartum. Cows and heifers had fewer cases of displaced abomasum and a tendency for less clinical mastitis in the first 30 days in milk. They did not observe an effect of the DCAD diet on RP, metritis, ketosis, or purulent vaginal discharge. In terms of milk production, older cows fed the negative DCAD produced on average 3 kilograms more milk at the first 2 DHI test days. No differences were observed in first lactation animals. Accounting for milk fat and protein percentages, cows in the second and greater lactation produced more milk at the first milk recording test after calving. So what about reproduction? The negative DCAD diet showed different reproductive responses when comparing cows and first lactation animals. In cows, those fed the negative DCAD diet had 10 percentage points greater pregnancy at first breeding, leading to cows being pregnant approximately 11 days sooner than cows fed a positive DCAD. In first lactation animals, pregnancy at first insemination was not different between treatment groups, but cows fed negative DCAD took longer to get pregnant. They also observed that cows were less likely to leave the herd if fed the negative DCAD diet prepartum. Better health, milk production, and reproductive performance might explain these results. They observed no differences in first lactation animals. What did they learn? Negative DCAD diet reduced the incidence of DA and tended to decrease clinical mastitis and culling incidence within 30 days in milk. In older cows, a negative DCAD diet increased milk yield in early lactation, improved reproductive performance, and reduced culling rate. In first lactation animals, there were no effects on milk production or culling, but treatment was detrimental for pregnancy rate. Negative DCAD diets showed benefits for health, production, and reproductive results for cows entering their second lactation or older. They concluded that a negative DCAD diet in the close-up dry period should ideally be targeted to cows calving for the second or greater time. Where only one close-up group is available for all cows, consider herd-specific data to decide on the merits of this tool.